My name is Jan Winnitz. I've been a practicing physician for over 30 years. My specialties are nephrology and internal medicine. Recently, I have been involved with a project which has been treating end-stage metastatic cancers. These patients have been coming to us from hospice care, having failed all other treatments for their diseases. Our treatment is a novel approach where we heat the patient till they get to achieve the temperature of 42 degrees centigrade. That's 107.6 Fahrenheit. This is done when we bring the patients into the hospital under general anesthesia. The patients are prepped in the usual way. We have central lines, we have monitors, we have temperature probes in 5 separate places. We then cannulate their central veins so that blood is continuously recirculated from the patient through our device and continuously returned to the patient. Under this situation, the patients are constantly monitored. Their blood pressures are monitored, the venous pressures are monitored, their heart rates are monitored, their chemistries are monitored every 15 minutes. The patient's blood is heated through our device through 115 degrees, and such that the patients get to be heated to 107.6 degrees. We have 5 temperature probes that has to be in concert for us to start the timing of our procedure. Normally, at temperatures of this degrees, there are several toxic agents and chemical abnormalities that occur that can cause vasomotor collapse in patients. In fact, this has happened many times in the past, which is why this treatment has never been successfully done until now. We correct these anomalies by having a parallel circuit to the continuously circulating heated blood device. This circuit is akin to dialysis, where the blood is filtered, the toxins are filtered, the chemistries are corrected. The filtration is run through a special filter which removes the toxins. The blood and the filtrate is returned back to the patient in a physiologic and normal state. This is under continuous monitoring for the patient. After the patient is at this temperature for 2 hours, the blood is returned to the patient. They are disconnected from the machine and they are extubated. It has been our experience that the patients have been awakened most often in the operating room. Their chemistries have also been kept in completely normal range. There has been no vasomotor instability, and traditional medications have been used in traditional ways to maintain the vital signs and stabilities of the patient. When the patient is awakened, they are found often to be slightly euphoric. They are monitored in the post-op care in the usual way. Chemistries and vital signs are monitored, corrections are administered when required, and then they are returned for further observation in the intensive care unit for 48 to 72 hours, and then on the floor at times for 48 to 72 hours. Our patients, in fact, can be released the next day in many cases. We have found extraordinary results with regard to the treatment of our patients. These are patients that have come to us in hospice care at the end of their hope, expecting only a few months to live. In fact, our patients have returned in many cases to their normal lives before they became ill. There are some patients within the first month after the treatment are doing the things that they previously enjoyed, such as canoeing or camping. Many of our patients have gone on vacation visited friends and family, and most importantly, have been alive to appreciate the special events that happen to family, such as births of their grandchildren, graduation of their children, etc. This experience is unique. In my personal experience of over 30 years of practicing medicine, I have never come across a device that will increase the longevity and the quality at both with regard to a patient's treatment. We often consider a successful treatment as something that increases the longevity. This does more. This increases the quality as much as the longevity. One can almost consider this to be the holy grail of medicine.